You're listening to the Bridge podcast, brought to you by Bridge, New Frontiers in Type 1 Diabetes.
Hello, everybody, and welcome to the final episode of this series. And today we have none other than Jurgen Vercauteren, or Professor Vercauteren. Now, without me taking time to introduce him, I'd be very grateful if Jurgen, do you want to tell us a little bit about yourself?
Okay, thank you, Partha. Thank you to everyone tuning today. My name is indeed Jurgen Vercauteren. I'm indeed a professor at the KU Leuven in Belgium. But I think today I'm wearing several hats here. I'm a researcher dedicated to early detection of type 1 diabetes. But I'm also somebody personally living with type 1 diabetes for almost a decade now. And maybe that's most important for today. I'm also a father of 3 children who have been screened for early stage T1D. And each of these perspectives have shaped the way I look at screening and the way I look at the future of managing this chronic autoimmune disease.
Not just the science, it's also the personal story as well, Jurgen, which is going to be fascinating to hear more about. But what about a brief overview of your own history and work in the field of type 1 diabetes? We can see the personal connection, but what about the work or the professional side of it? Is that linked?
Yeah, of course. I think it's linked, and it's linked for a lot of people in the field. But my professional background originally had nothing to do with type 1 diabetes. I completed my PhD, in fact, in medical sciences working in the field of HIV, epidemiology, and drug resistance. And I was actually fully committed to the infectious disease area at that point. But then life struck quite literally out of the blue like a bolt of lightning. And I was actually diagnosed with type 1 diabetes myself quite late, at the age of 39, so 10 years ago. So you might say a typical case of LADA, and I didn't have anybody in the family. So it came really like out of the blue. And that experience changed for me quite a lot. And I really felt a strong urge to change my scientific way of thinking towards T1D. And then after some time, and actually after persistently pulling the sleeve of Professor Chantal Mathieu, who's actually, as you know, of course, one of the true leaders in this field, I was actually fortunate to join her team, and I became one of the project managers of the Identify consortium. Now, maybe before you ask me more about Identify, I think maybe, Partha, it's quite important to clarify some of the basics of diabetes for our listeners, and especially of T1D screening, because in fact there are 2 types of screening that are often confused. At the one hand side, you have the genetic screening that looks for certain HLA genes that significantly increase the risk of developing T1D. But at the other hand side, and that's our project is about, you've got the autoantibody screen that looks for the immune markers. So the islet autoantibodies in the blood, and that can really indicate that the disease has already started, even if you don't show symptoms yet. And now, roughly say in the general population, if you go to babies, newborn babies in the general population, the lifetime risk of developing type 1 diabetes is about 1 in 250 newborns. But of course, if you have a first degree relative with T1D, like a parent or a sibling, that risk will increase with 10 to 15 fold. So if you carry even the high risk HLA genes, that risk can even further increase. So then you have a risk of 1 in 10 to develop T1D in your life. But all these things about genetics are all about risks. So most people, even if they have those genes, will not develop the disease. And also vice versa. People who have developed disease doesn't necessarily have the genes in their body. So therefore, this new way, it's not that new anymore, but this quite relatively new way of screening for the autoantibodies is so powerful. It can if you detect like 2 or more of those markers in the blood of a child by just using a finger prick, you can really say that the child has early T1D.
I think you've beautifully crystallized one of the big things that people always get confused with. What are we talking about screening? Is it the risks? Is it the actual sort of, okay, you got early type 1? You briefly mentioned, and I think we will go into a bit more detail now, the identify. So tell us a little bit more about it, because that sounds fascinating. It seems like a very big passion project for you. So tell us a little bit more about it.
Identify is indeed a quite new program in the field. It's actually a public-private partnership. We've got 27 partners across 13 countries, and we've got a quite ambitious goal. We want to screen over or at least 200,000 children and for early stage T1D. And we have already met like more than 50,000 now, and we're only like 1 year ahead in the program. And it's really interesting because some of the countries, the participating countries in Identify, are starting screening programs completely from scratch. I think about Portugal, Italy, Poland, and the Czech Republic, and they do very well. Other countries, they build further on successful models like the German FRIDA study. But in Identify, we want to go broader. We want to test the different models of screening, and we want to see if they can be adapted to different healthcare systems. Okay. And on top of that, we are really doing research. I think it's not only about screening. We're also trying to answer scientific questions like how should a population screening be organized? So general population screening. What is the psychosocial and the health impact of finding out that you have early stage T1D? And very important, I think, how should children that are identified with that early stage should be monitored over time? And the thing that I'm responsible of in Identify is about communication, because I think it's very important to do the proper communication towards families, but also toward the healthcare professionals, toward the policy makers. So I think in Identify, we've got a very clear mission there. So we want to screen for the early stages of type 1 diabetes, and we don't want to do it randomly. We wanted to do it in such a way that it will become an evidence-based part of our healthcare.
So I think, one of the things we talk about in this whole debate that's going on about, is it the right thing to do, about who should we screen, early detection? Is it just the people who have risk factors? Is it the general public? What's your view on this? How do you see it?
Well, indeed, I think it's very important to distinguish the target audience that you're talking to. I mean, if you start with the general public, so people without any connection with diabetes or screening at all, in my opinion, in general, people are quite open to the idea of screening. But the truth is that they're often completely unfamiliar with type 1 diabetes, let alone the idea of detecting it early. Mm-hmm. And to add a personal note on this, I remember very well when I myself was diagnosed at the age of 39. Before that, I barely had any knowledge of type 1 diabetes. So I think it's understandable that when you talk to people from the general population, you often have to start from zero. You have to explain them what type 1 diabetes is, what is the difference with type 2, what are autoantibodies, and why this early detection really matters. Mm-hmm. And when I'm in conversation with those people, I try to convince them, of course. Sometimes they say to me, but why should I screen? My children are healthy. But then I'm just answering, why shouldn't you do that? Because you have to know, of course, that we can bring a positive story here. I mean, in more than 99.5% of the cases, you can just tell to the parent that there were no autoantibodies found in the blood of their children. And that will really reassure them. It will give you peace of mind. Of course, I think it's very important to emphasize that no test is 100% definitive. There is always a small risk on developing later, but that probability is really small. And another question that I'll often ask is about the age of screening. So when should you start screening? I think you should do it as soon as possible if you can, of course. And therefore, you have to look at the markers. When are those markers detectable in the blood of a child? And we know from research that in most children, they will develop these islet autoantibodies from the age of 2 already. So if you wait a bit longer and you, for example, screen once at the age of 4, you can catch already 40% of the future symptomatic T1D cases by the age of 15. And if you're in the possibility to screen twice at 2 different ages, let's say at the age of 2 and the age of 6, then the sensitivity of that screening will increase further to 80%. And so the test is very, very strong. The positive predictive value is almost 100%. So it means that if a child shows 2 or more autoantibodies, the child will almost always develop the clinical stage, the stage 3, as we call it, within 20 years, and even earlier than that. On top of that, and then I will stop because I may be talking to a lot. What about reversion of those autoantibodies? Can they go away again? Can they become invisible in the blood? Well, that's quite rare. And there were studies before, like the TEDdy study, and they saw that in less than 1% of the cases, you got this reversion of these autoantibodies. So early stage T1D, if you do it by detecting autoantibodies, it's very real and it's very predictive.
Yeah, and I think, Jurgen, I mean, it's not at all more information. I think the more information that you pass on, and it shows your passion, and these are questions that people have, right? Because one of the things that comes up is, and you will hear that, is that, oh, do people really want to know? And I, is it the sword of Damocles over your head sort of thing? What's your view on that? I mean, the Frida study, you referenced it previously when I've heard you speak. What's your view on that sort of concept?
So I think the anxiety is not more than you do if you don't do the screening, of course not. And it's even less because what you can do with screening, you buy time. So you really buy time. You can start informing the parents, educating them, telling them what to expect. And I think most importantly, you can follow up the children over time. And then you are there when symptoms will arise. Right. And then, of course, that's way better to prevent all these complications.
So, I mean, we talk about the population. So what about those who are already living with type 1 diabetes? Is it more obvious? Is it more straightforward? Because obviously what's happening, people are moving into it. People are talking, we should integrate screening into national healthcare systems. Let's talk about high-risk groups, first-degree relatives. Do you think it's more easier if you got parents? I mean, in your case, is it easier, for example?
Well, I used to think that I was able to detect the symptoms, that I wouldn't need to have a screening test. And I hear that quite often when I talk to people with T1D. They say, "Oh, but I know the disease. I will see the symptoms." I'm not so sure about it. I think those symptoms can happen, as you know, Partha, very quickly, very suddenly. And I would say, why take the risk? Why take the risk when screening can give you like this peace of mind? And so personally, I've lived with T1D for 10 years and I've got 3 children. And honestly, it was only after that I started to work on the Identify project that I finally got around to screening them. And I think it's important to acknowledge that there is a lot of emotion involved as a parent. And you feel guilty, you feel the fear that you would pass on the disease to your children. But if you're properly informed, you can make the decision to screen your children, and then it can give you a peace of mind. In my case, it did. My 3 children were screened negative, and okay, that gave me peace of mind, and I've taken the responsibility, and I think that's very important. But it's not easy. Also, not with people with type 1, because children, for example, part of people with type 1, they will see their parents struggling with the disease. My children have seen me experiencing my hypoglycemia. They have seen, of course, the bad sides of living with T1D. So even convincing my children to get them tested was not so easy. Yeah, so I was able to do it by promising them some presents, and then I finally managed to do them.
But I think you're showcasing, you've briefly touched upon it. I mean, it's a big challenge, right? Isn't it? To try and get it out there. What are the barriers that you still see? I mean, you talked about what we can do and identify, and doing an amazing job, as you see, with the science and the research. But there seems to be a wider responsibility. It can't be just the academics and researchers who have to drive this today. I mean, what do you see? Where do you see other people can help with the barriers that there is?
Yeah, indeed. If we rely on only researchers like us, I don't think we will make it happen. So indeed, we have to reach out to, or we have to count on the responsibility of all the healthcare professionals, especially those in countries where, for example, family pediatricians have an important role to play. I think about Italy, where they have a really strong network of family pediatricians. They can really play a key role here. Having said that, I also think that there is a role for all the patient advocacy groups out there and the organizations on T1D. They can also help by raising awareness. Also companies, of course. Let's not forget the companies. They can provide objective, a non-promotional education, actually, like we are doing now with this podcast. Yeah. They have an important role to play as well. And of course, in the end, it will be up to the policymakers to try to integrate the screening in their national healthcare systems.
I couldn't agree more. As I always say, the best science is the one that gets into people's lives. So I think that everybody has to work together to get that happen. Now, I'm going to flip that question. Now, I'm going to ask you to take off your clinician hat or the academic hat. What do we as physicians need to know about the perspectives of those we're going to consider screening? So if, your family is being screened, what would you think we need to be aware of as clinicians when we are setting it up?
Well, they have to be informed very well, because I think a lot of parents will reach out to their clinicians and ask about screening. And if the healthcare professional, the clinicians, the physicians are not convinced themselves, I mean, we will not get it up and running. And I think also towards the children themselves who get screened, it should be as easy and as painless as possible. So just using a finger prick, that's possible. And then, of course, for those children, unfortunate, 0.5% of the children will have to be followed up after the positive screen. And this follow-up can also be done in such a way that it's less burdensome for them. I mean, nowadays we can use CGMs, so sensors on the arms of children, and then we can see over time how the glucose level evolves. We don't need, if we don't have to, we don't need these oral glucose tolerance tests that children don't like. We can try to prevent them. That's a personal opinion. And on top of that, also the healthcare physicians should be aware that also parents will have questions, and they will need support. They will need psychological support. So it's not just about screening and getting the diagnosis. It's more than that.
Thank you. Now, time flies, Jurgen. Thank you very much for your time. I actually learned a lot from that myself. So I'm sure our listeners will love that. And I really wish you all the very best with what you're doing. I mean, I had a look at the Identify website, and your current number of participants, more than 50,000. You've got so many people in there. It's brilliant to see, you're shaping and changing lives. So I wish you really all the very best in all the future activities that you're going to do. To all our listeners, please do listen to the series, and hopefully you've enjoyed this particular podcast with Jurgen. And I would also encourage all listeners to visit the Bridge website, engage with all the high-quality educational outputs that are there. So without further ado, I'm going to again finish this by saying thank you for your time and your insight, and definitely a benefit to everybody who will listen. Thank you very much.
Thank you, Partha. Bye-bye.
For more Bridge content on type 1 diabetes, including the latest events and initiatives, find us on Spotify, YouTube, and our website.